Heart disease and high blood pressure. From the day we are born to the day we die, our heart never stops its ceaseless pumping of oxygenated blood throughout the body. Amazingly, it contracts between 70 to 80 times per minute, day and night, for a typical lifespan of 70 years. For many individuals it beats even longer. The muscular walls do get an occasional respite during the diastolic phase, but it is only a temporary respite. Because the heart is never given time to recover from its arduous exercising, it requires a constant supply of oxygen. If you're in poor physical condition and decide to run for a bus, for example, your heart and lungs would be unable to meet the sudden demand for extra oxygen-rich blood. As a result, your leg muscles can't receive the oxygen they need, and you'll likely experience pain or leg cramps. However, on the positive side, you can rest the muscles in your legs and give them the opportunity to recover from their exertion. Unfortunately, your heart doesn't have this luxury. If the muscles of your heart were to rest, your entire body would stop functioning and you'd die in a very short time. Here's how your heart works. The coronary arteries which transport the blood to the walls of the heart emerge from the aorta, which exits from the left side of the heart. The heart tissue becomes infused with the blood, and pumps the remaining blood out to other areas of the body. Problems arise when plaque seriously limits the cardiac output. One of the more serious consequences of hypertension, or high blood pressure, is cardiac damage. This results when the pressure of the blood going through the heart is abnormally high, and eventually the heart can't cope with the prolonged and systematic pressure. It will eventually begin to fail, often with devastating results. Once the heart is damaged as a result of high blood pressure, other problems can develop. These may include heart disease such as angina, or even a heart attack with all the accompanying symptoms and problems. Can anxiety affect your blood pressure? As we briefly mentioned above, assessing your blood pressure readings can be trickier than it might at first appear. It's the numerous variables that come into play that make it so tricky. In order for your doctor to gain a complete picture of your specific situation, he needs to be aware of the impact these variables may be having on your system. Here's a short list of factors that can affect your blood pressure reading. Your emotional state, exercise, respiration, a recent heavy meal, smoking, your alcohol intake, the room temperature, pain, bladder problems, circadian rhythms, your age, your gender, your race. As surprising as it might sound, anxiety can raise your blood pressure by as much as 30 mm Hg. Even anxiousness about visiting the doctor or about how well you'll do when he takes your blood pressure can cause an instinctual fight or flight response that raises your blood pressure. The more anxious you are, the greater the impact on your readings. So always keep in mind that you should be relaxed and comfortable when your blood pressure is taken. If you have the opportunity to sit in a quiet room, at a comfortable room temperature, and maybe thumb through a favorite magazine beforehand, take advantage of this opportunity to settle down and put aside your fears. You want your doctor to have the best information possible before prescribing any medication, and the best way to make sure your blood pressure readings are accurate is to put aside your anxieties. The more comfortable you are with your surroundings and with the person taking your blood pressure, the more accurate your readings. In fact, it's been found that your blood pressure measurements are generally higher when taken by your doctor, and to a lesser degree, even your nurse. This is known as the white coat syndrome, and it's something to be aware of next time you go to see the doctor. You should also be aware of your respiration and pulse rate, since both can affect your blood pressure reading. If you had to climb a set of stairs to get to your doctor's office and your heart is racing, make sure you have at least 15 minutes to relax and settle back into a comfortable resting pulse rate before your blood pressure is checked. Finally, learn as much about your blood pressure as you can ahead of time. This will generally put your fears to rest. And if you have any questions or concerns, ask your doctor. He should be able to give you a thorough explanation of how your blood pressure works and how it might or might not affect any existing medical conditions you may have. Blood pressure ranges. Blood pressure ranges are not necessarily the same for everyone. There are varying factors that need to be taken into account. For instance, age, race, health and gender all influence a healthy blood pressure reading. However, blood pressure ranges do provide an important perspective in the diagnosis of many diseases. So, in general terms, a healthy person should have a systolic pressure no higher than 120 mm of Hg and a diastolic pressure approximately 80 mm of Hg. 120/80 is considered to be a textbook classic blood pressure of an average person. An experienced medical practitioner will often interpret a patient's blood pressure range with the understanding that some patients become excited or agitated simply by having their blood pressure taken. Therefore, a slightly elevated range may not necessarily be a concern in all situations. This is why your physician not only takes your blood pressure every time you visit the office, but also encourages you to come in for periodic readings even when you're feeling fine. The more data he can assemble over time, the more he can determine if there is reason for concern or not. A systolic blood pressure ranging from 140 mm to 159 mm, along with a diastolic blood pressure ranging from 90 mm to 99 mm is known as stage 1 high blood pressure. Similarly, a systolic blood pressure of 160 or higher, along with a diastolic blood pressure of 100 higher, is known as stage 2 high blood pressure. The higher end of a blood pressure range in a healthy person is normally expected to remain below a systolic pressure of 125 mm. Systolic pressure measures the compression capacity of cardiac tissues in a person's body coupled with the free flow of blood in their arterioles and arteries. Similarly, the lower end of a healthy blood pressure range is expected to remain at or below 80 mm. A persistent low diastolic blood pressure range between 85 and 90 may warrant your physician to prescribe an antihypertensive drug. This is even more important if the condition is linked to symptoms pertaining to cardiovascular disorders such as feelings of intense pain in the body, increased sweating, or with symptoms related to the end organ damage in body. This video for information purposes only. Thank you for watching.